Hello, Dr. David Murphy here. I hope you're all well by practicing social distancing and self-isolating if you need to. There's going to be a lot of crisis coming up, I believe. A lot of countries are in crisis already. We're doing quite well here in Canada, but certainly the alarm bells are being sounded. Emergency rooms, intensive care units are getting prepared. Just in case for the worst. They're practicing that little bit of pessimism that I talked about yesterday. At the same time though, when crises happen, we can become overwhelmed by the information that's coming at us. Lots of thoughts, ideas, emotions, physical sensations, a lot of events going on around us. And we need to learn how to focus our thinking. I worked in an emergency room. I've certainly taken care of patients in ICU. And when there was a crisis going on with a patient, it was very important to be able to focus my thoughts. And this technique can also be applied to life in general. When a lot of stuff is going on in life, we need to be able to focus our thoughts. So here's a way of doing it. It's a guided imagery technique. So it's a way of creating an imaginary container where we're going to put all those thoughts, the ideas, the photos, the videos, the conversations, the thoughts, the noises, the physical sensations, everything that's going on inside and outside of us, we put in this imaginary container. And what's important about this imaginary container is that it's quite magical, because no matter what it looks like on the outside, it will have an infinite amount of space on the inside. So it can never be full or even close to being full. And so what you do when you're feeling overwhelmed by a crisis or events that are going on, put everything in that container, using whatever imaginary pictures work for you to represent that information. Your thoughts, ideas, sounds, conversations, the physical sensations, photos, videos, the visual information. Put everything in there and keep putting everything in that container until your mind and body is completely at peace. And then you put a lid on the container and seal the lid so everything is settled in there temporarily. Because only temporarily. What you've done as you put that information in is you will have made a commitment to come back to each and every item in that container at some time in the future when you have the resources and the skills and the time and the energy to really resolve the information in there. So you're not stuffing it away, you're not ignoring it, you're just putting it away temporarily, and then you're going to seal the lid with glue. You can tape it, you can weld it, chain it, anything you like. Now that everything's in the container, you need to have a method of taking it out in a controlled manner. So what you need on your container now is some sort of one-way tap or valve or a faucet that will allow you to let information out of the container, not only at a time and place of your choosing, but also at a rate of your choosing. So you'll be able to let out of that container just one item at a time, while everything else remains in the container. That one item that you have the energy, the resources, and the time to manage. And the item will be just large enough that you can manage it. So you only let out small items, things that are manageable, while everything else remains in the container. And then also what you need on your container is a one-way slot. A one-way slot that allows you to put information in the container without letting anything out. Because sometimes when we take something out of the container, well, if it's completely dealt with, we've resolved it, it'll just kind of disappear. It'll be done. It's off the agenda list. But sometimes we need to take something out for a little while, work on it, and then put it back in the container, have a method of putting it back in without letting anything out. And of course, stuff happens, life happens, things come up. Sometimes we just don't need to deal with that particular item at that particular time and place. When I was working on something in ICU, perhaps a patient came in to emerge, but they were a lower level of crisis than the patient I was working on at that time. So I put that patient out of my mind and made a commitment to come back to it at some time in the future. So if something comes up like that, I just don't need to deal with it, or I can't deal with it, we need to be able to put it in that container using that one-way slot. And then of course, we need to put that container away somewhere safe or secure. It can be an imaginary closet or a cupboard or a drawer, or just somewhere at the back of your mind, somewhere where it's safe and secure and at the same time available to you. But at the same time, as I was saying, I'm losing my words here, but I'm going to carry on. So it needs to be out of the way so we can focus our attention on everything that's going on around us now in the present time and the present place. It's out of the way, ready to be pulled out and used and bring something out when we have the time and the energy. And in the meantime, it's gone. We can focus on the present. We can relax and feel comfortable. So practice that little imaging technique. It works really, really well. Remember, practice it in a quiet time. It's not possible to practice something in an emergency situation. We need to practice in the quiet time, much like sports teams. You can't practice a particular drill with the team while the game's going on. You need to practice in practice time. So practice that, enjoy, continue social distancing. I was going to say keep safe, keep well, keep healthy. I'll talk to you again. This is Dr. David Murphy.